The Pink Run is more than a 5K run or walk. It's a chance to honor survivors, support fighters, and remember those we've lost.
Whether you've lived it or loved someone who has, this is your moment.
Join us on Sunday, October 26th, and let's walk, run, and restore hope together. To register, call 876-445-9407. Pink Run is brought to you by Jamaica Reach to Recovery.
Pink Run is powered by Catherine Speak, Juicy Patties, Jamaica Moves, JP Foods, Supreme Ventures, NHF, and M Catering. Reaching hearts, restoring hope.
Come on, get ready for the sun.
Good evening, good evening, good evening. Once again, we welcome you to Pinktober. Jamaica Reach to Recovery is going to be at this same time, this spot, every Thursday at 7:30 p.m. This evening, like every Thursday evening at 7:30, we have a wonderful speaker, Dr. Derria Cornwall, and we are going to debunk, we are going to discuss, we are going to thrash out mammograms and getting tested for breast cancer. Breast cancer is the second highest cancer killer in Jamaica. And the first cancer, the top rated cancer killer of our women in Jamaica. 1 in 8 women, 35% of the women in Jamaica are exposed or will have breast cancer. Now those numbers are too high. From where I sit as president of Jamaica Reach to Recovery, we see too many women coming in late stage breast cancer. I am Sandra Samuels, president of Jamaica Reach to Recovery, and we aim to educate and inform every person on this platform about cancer. I myself am a 26 breast cancer survivor, and we are here to speak about how important it is to get tested, because early detection is the key to survival. So this evening, our guest, I'm only too happy to introduce our guest, Dr. Derria Cornwall. And she is, let me tell you a little bit about her. Dr. Derria Cornwall is from Trinidad and Tobago, but she is Jamaican. Let me tell you, she is all Jamaican. Dr. Cornwall obtained her degree in medicine at UWI in 1997 and later specialized in radiology. She did sub-specialty training in breast imaging and at Nottingham Breast Institute, UK in 2009, and is a consultant radiologist at University Hospital of the West Indies, where she is the head of the Women's Imaging Center at University Hospital. She is also an associate lecturer at University of the West Indies. Dr. Cornwall is the founder and managing director of Precision Imaging Center Caledonia, Crossroads, Kingston, in Jamaica, where they do x-rays, ultrasounds, digital mammograms, and CT scans. She is the Health Ministries Director of Andrews Memorial, a Seventh-day Adventist Church, Kingston, Jamaica. She plays the guitar and enjoys a good game of netball. Dr. Cornwall does presentations on cancer awareness, other health topics for numerous organizations. She volunteers with Jamaica Cancer Society and writes articles for the newspaper, Gleaner, Observer, various magazines on issues related to screening and early detection of cancers. And we are very happy to have Dr. Cornwall with us this evening. Welcome, my friend. I know that, yeah, unmute.
Am I
Yes,
still
you're unmuted now, yes.
I am delighted to be here, Sandra, to share. I am actually humbled and delighted and also inspired by your experience and your long 26 years of history, which in itself is an accomplishment. I am inspired by you as well, your strength and vibes and vigor and vitality, and your willingness to share, to have others learn about your experience and your journey with breast cancer.
Well, Doc, I asked you here today because you know the challenge that we are having with persons going out to get screened. This is one of the major issues that we're having. I'm not even going to say it's Jamaica alone. More than likely it's worldwide. I'm not sure because I can only speak to the Jamaican situation. But I thought it was imperative that we address the fact that women, one, are not going out to screen. And what from where I sit, I'm hearing that women are afraid of mammograms, that it's painful. And I just want you, because when I speak to you, I feel like I understand everything you said. So I want you, one, first of all, why do you even choose this area of medicine? And two, I want you to start from ground zero about getting yourself tested, what age you are to get tested, and if you're not that age, what am I supposed to be doing? Just give us an overview. Tell us a little bit about yourself, and then we go into the real crux of the matter.
So I'm a radiologist, which means that I am one of the imaging experts. So we use imaging, x-rays, mammogram, ultrasound and stuff, biopsy to help in the diagnosis and treatment and management of patients with disease. Today we are talking specifically about breast cancer and screening. And one of the things that got to me is that we keep seeing a lot of women waiting until they have a lump, starting their screening late, or saying, "Oh, me, I am a Christian. I go to church. I'm not even listening to them talking about breast cancer because I first of all, breast cancer is not in my family. It's only because old age and diabetes and hypertension kill my grandparents. I don't have no cancer in my family. These kind of myths. Oh, I'm not going to be screened. I'm not doing no mammogram because mammogram cause cancer. That radiation when them squeeze the breast, it squeeze out cancer and make you get cancer. I've heard so many myths about this thing that it really got me concerned that we really need to push and encourage women to about the truths about screening for breast cancer and the fact that breast cancer cannot be 100% prevented, because people say, "Oh, I eat healthy, I don't eat meat, I exercise, I don't smoke, so I cannot get breast cancer." We hear so many myths that I really said we need to debunk these things and really get women into the reality of the truth about breast cancer. The fact that if we catch it early, we can get them on a good path to living a healthy, good life. So we really want to get women on board with the truth.
Doc, all right. So I am living my nice young life. At what stage should I start checking my breasts? I don't have it in my family, right? But at the same time, I want to be responsible. At what time should I start checking my body? as an adult
Very good
who
question.
wants to live a healthy lifestyle and ensure that, I check myself.
So every woman, starting from your teenage life, every teenager should start examining their breasts, right? And if they feel any lump at all from teenager coming up, including men, all teenage boys, girls should start being aware of themselves.
Because men also do get breast cancer.
Yes, men also can get breast cancer.
Right.
It's just that it's much less common in men. So in women, they say 1 in every 8 women will get breast cancer in a lifetime. But for men, it's 1 in every 3,000 or so men. So it's much less common. But I know men with breast cancer, and to them, when that man has breast cancer, he's the only man in the world. He doesn't see himself as 1 in 3,000. He sees himself as the only man in the world, right? So we encourage teenagers, girls and boys, to check themselves out. If you ever feel any change in your breast or any lump or anything, go to your doctor and get it checked. They may examine you, send you for an ultrasound or something to get you checked out, right? And we continue doing this. So men, boys, as they come up to become grown men, must be aware of themselves and check themselves every month. Just be aware of themselves. And if they feel any change, get it checked out. For women, we say teenage girls start coming up, start examining your breast after the menstrual period. And if you feel any lump or so, go to your doctor. Tell mommy, tell auntie for the teenagers, and they will take you, or daddy, they will take you to the doctor, and the doctor will examine you and then send you possibly to get an ultrasound or to get things checked out, right? So that is what we say to people. All teenagers coming up every month. For the girls, check your breast, examine yourself.
So a good time to start, would a good time to start when you start having a period?
Yes.
When we call going into womanhood?
Yes. When you start seeing your period or so, after the menstrual period, you start that monthly, especially after the period, feel the breast to see if you feel any lump, feel how it feels. If you feel any lumpiness or anything new, let mommy or auntie know, and daddy or your guardian, and they will take you to the doctor to get it checked. And you continue your checks every month into your 20s, into your 30s. You continue checking yourself every month after the period. Now, when you
might say to me, Doc, you're starting too early. You're paranoid. You're going to bring down, people are going to bring down cancer on yourself if you keep on looking for it. What do you say to that?
That is not the truth. Nobody brings cancer on themselves. Nobody. We want you to be aware. When a woman has reached the age of 30, we advise that all women, when they've reached the age of 30, they should go to their doctor, get the doctor to check them and do a risk assessment to see if they should start their mammogram at 30. Because women who have the breast cancer genes in their family or who have first-degree relatives with breast cancer may need to start their mammogram as early as 30.
So all right, stick a pin right there, Doc. You touch on a very valid point. So my mother had breast cancer, my sister, my grandma, my very close relative. So I should start, first of all, do I need to have a conversation with my doctor to tell him my family history?
That is what I'm saying. You are so correct. So because based on what your family history is, whether it be for breast cancer, ovarian cancer, prostate cancer, pancreatic cancer, there are various cancers that are related to certain genetic syndromes that can put a woman at risk that she may not ordinarily just know about from her own general knowledge. So women, when they reach 30, should go to their doctor and have a conversation about my risk. What is my, and then he or she will then ask the woman, the young lady, different things that could give him a different overview of her risk profile. And then he would, or she would, the doctor would say, okay, you need to start your mammogram at 30.
Okay.
Right? And he will then write her a request to go to get the mammogram done, because if you're doing your mammogram from 30, you would have to have a request from the doctor to allow you to do that mammogram. Right?
So high risk is having a member of my family, close relative, who has had breast cancer alone or any type of cancer.
So there are certain cancers that increase the woman's risk of breast cancer. Those are like ovarian cancer, pancreatic cancer, prostate cancer, and some sort of colon cancer that can, there are some family histories with those cancers that could increase the woman's risk for breast cancer. And the doctor can pull that out of your conversation with him or her, the doctor. Right? And some women don't know. So first of all, we advise women to kind of get into your family history. Ask your mommy, ask your grandma, ask your daddy, what are some of the things that happening to people in their families? Right? Be aware of your family history. And then now, even if you're with your awareness, don't sit and decipher that for yourself. When you reach the age of 30, go and talk to your doctor and have a conversation to see what's your risk profile, and your doctor would assess you. Right? If it is that your risk profile puts you at high risk, then the doctor would say you need to start your mammogram at 30.
What are some of the other risk factors outside of your family history?
So the family history, personal history within yourself of, if you've had a lesion in your breast and you biopsied it and it showed some atypical features, that may increase your risk and make you have to start your screening earlier. Right? Now, if you therefore, but the main factor that puts you at increased risk is if you have the genes for breast cancer in your family, like the breast cancer 1 or the breast cancer 2 genes, like the Angelina
What we call the BRCA gene.
The BRCA genes.
Right.
Right? They can test the saliva to see if you have the increase, those genes in your family. And if you have those genes in your family, that puts you at increased risk. Now, that said, it's only about 15% of women who actually have the BRCA genes or the Cowden genes or any P10 or those genes that increase your risk for breast cancer. But that is a conversation that you have with your doctor, who will send you for the genetic testing. And if that is so, or other factors, then they would put you on the breast cancer screening profile with the mammogram. Now, that said, it's only about 15% of women who fit that profile, but we just don't know who. So it's when you have the conversation with your doctor that will be determined. And all women at the age of 30 should go and have that conversation. Now, let's say now that you don't fit that profile. The doctor may say, okay, you are of average risk. You don't have any increased factor for getting breast cancer more than simply being a woman and getting older. And the biggest risk factor for getting breast cancer is being a woman and getting older. And when a woman reaches the age of 40, even if she does not have any risk factor for getting breast cancer, just getting to the age of 40 jumps the risk up. Right? So all women who have reached the age of 40 should now give thanks that they reach 40, because many people die and don't reach that age. But just reaching 40, the woman should now start having her mammogram, even if the breasts feel normal.
Some people say, Doc, that, the whole part radiation with mammogram, next thing it give me cancer. What do you say to that?
I like that point, because that's the truth. Now, when a woman has reached the radiation that a woman is exposed to when she does a mammogram, when we do mammograms, is equivalent to the amount of radiation you would have gotten if you take a trip to New York and back. If you take a trip to Germany, you take a trip to France, you take a trip to Trinidad. As the plane goes up in the air, the air gets red and you're exposed to radiation. And that radiation that you're exposed to when you take a trip back and forth is equivalent to the radiation you get when you do a mammogram. So when you go to do a mammogram, it's like taking a trip. Now, if that radiation was to kill us, then all of us will be dead already. All the air hostesses and the pilots will be dead, right? Because you would have been taking, I am not even Jamaican, so the radiation that I would have been exposed to when I come here, and I have to go home every so often, twice or so per year, I go home to check out my people them, right? And if that radiation was to kill us, then all of us would be dead. Let me put it a different way. The radiation that you get when you do a mammogram is equivalent to the amount of background radiation you would have had for living on Earth for the last 3 months. Because right now we are exposed to radiation that we are just not aware of, just from living on Earth. You are exposed to background radiation. Even before, yes, you're exposed to background radiation. And that radiation that you're exposed to when you do a mammogram is equivalent to how much radiation you would have had been unbeknown to you, according to Jamaican them. Unbeknown to you. The background radiation that you would have gotten over the last 3 months from just living on Earth is what you are getting when you are doing a mammogram. So therefore, if that radiation would have killed you, then all of us would be dead. Because each year you have 12 months in the year, and that 12 months, if you have 3 months. So the radiation you got for 3 months in 3 months out of the year is what you're exposed to at a mammogram, when you do a mammogram session. So therefore, that radiation is low dose, because when you reach the age of 40, you would have had how much 3 months you're living in that in over the last 40 years. It's a whole heap of 3 months that. Right. And if radiation is going to kill you, then we would all be dead. Because by the time you reach 40, you would have had how many 3 months? Whole heap of sessions of 3 months.
A lot of exposure.
A lot of exposure. So it's a
so
load.
there are other factors, Doc. We hear about obesity being one of the risks. The types of job that you are involved in.
Yes, so obesity. So here it is now. Some ways to lower your risk factor for breast cancer. One, cut down on body weight, right? Because fat produces estrogen, and estrogen can cause cancer in some women. Not every woman is estrogen a factor, but we would not know. So we don't want you to have excess estrogen running around in your body. And fat can produce excess estrogen, right? So we encourage women to cut down on their body weight, decrease the fat in your diet, because increased fat in your diet could increase your risk for breast cancer. Inactivity. Exercise is important, because being inactive could increase your risk for breast cancer. So exercise not only decrease your weight, but exercise itself could also increase or boost your immunity. Alcohol, cut back on alcohol. We say there's no safe amount of alcohol to take. Any amount of alcohol that you take, it may increase your risk for breast cancer without you knowing. So limit alcohol or no alcohol. Cigarette smoking, burn that. Burn the cigarette. No cigarette. Smoking can increase your risk for breast cancer, right? We also say that there are certain jobs that could increase your risk of exposure to radiation and stuff, bad radiation, right? So you and the truth is that if you would focus on your lifestyle choices, like your diet, exercise, body weight, cigarette smoking to not have, and decrease your risk, your alcohol consumption, those could decrease your risk for breast cancer. But the truth about it is that all of these things put together can only decrease your risk for breast cancer by a certain percentage. It does not. A good healthy lifestyle does not 100% decrease your risk for breast cancer. So while you are having a healthy lifestyle, which would pull you away from breast cancer, getting older may be pushing you to breast cancer. So when you've reached the age of 40, even if you have the best lifestyle on earth, even if your lifestyle is Catholic and wholesome, you are still getting older. And getting older will still be, we're not sure who's getting older will be increasing your risk to the point where you can really get breast cancer. So therefore, every woman, when you reach the age of 40, even if your lifestyle is the best, cleanest lifestyle out, and plus on top of that, you go to church and you serve God and you're the deacon of the church and the pastor and the elder and the leader of the church, you still may be exposed by your age to getting breast cancer. So even if you are the best Christian on earth, you still need to get checked. Start doing your screening with mammogram, because you don't know if your age for you, who will be at risk for getting breast cancer.
So everybody has a fair chance.
Yes. And nobody can boast. Nobody can boast say, me can't get breast cancer because me live the best healthy lifestyle. Plus, I am actually a Christian. I believe in God. I can't get breast cancer. No, being a woman and getting older is the biggest risk factor for getting breast cancer. So when you reach 40, everybody needs to start getting their mammogram. Now, the thief of cancer don't go to everybody's house. But it's only the thief know who house he's going or she's going to. So everybody have to check the house. Right? Once you reach the age of 40, get yourself checked, start doing your screening, so that if thief trying to break into your house, the thief of cancer, you catch him early, dash where the key, treat him, and dash it away, and live your life like how you like how Auntie Sandra. You see how Sister Sandra living a good life? Right? I'm so sorry. You understand me?
What are some of the things that we're looking for? Signs and symptoms, Doc?
Okay, so the earliest sign of breast cancer is nothing at all. Normal. Breast feel normal. Now, so we don't want any woman to wait on any sign or symptom, but let me tell you the signs or symptoms.
By the time you find a lump, it might be late.
It might be a little too late. So those signs are lump in the breast, nipple discharge, rash to the nipple could be a way that cancer can show up. Just a scaly rash to the nipple. Don't ignore any rash. Sometimes if a woman may have the skin of the breast may look like an orange, pulled around.
Dimpling
of the skin. Right? That is another way in which cancer can show up. Right? So what we advise women is to be aware of your breast. We don't say do breast self-examination. We call it breast self-awareness. Right. Be aware of how your breast feels or how your breast looks. Right? And if there's any change in the way the nipple shape, if it starts to invert or it starts to point a different way, your nipple is supposed to point straight ahead. If you see a nipple changing shape or pointing to the side or any dimpling of the skin, even if your mammogram was normal, you need to go and get that checked. Right?
Yes. What about fluids?
Any well, that's a nipple discharge. Any fluid coming from your nipple is not normal, especially if it's coming on its own, where you didn't squeeze the nipple and you see liquid coming from it. Go and get any changes in your breast. Get that checked. But if you don't have any changes or any signs or anything happening to your breast, every year once you've reached the age of 40, you join the mammogram party.
Okay.
You join the mammogram party and get your mammogram done every year from 40 up. And I know I'm listening, women may be listening to me who say they are 50, 60, 70, 80 and say, no, so me too old for get mammogram. We're not going to get it. No. Once you have good health, where you can withstand the treatment for a breast cancer if it is found, you need to go get your mammogram done. I have patients who are 80, 90. I even have patients who are over 100 getting their mammogram done.
Doc, so every lump is cancerous, Doc?
No, every lump is not cancer.
So I don't have to panic if I find a lump.
Don't panic if you find a lump. If you find a lump, go to your doctor. Your doctor may send you, depending on your age, the doctor may send you to get a mammogram and an ultrasound. And if you have a lump on your mammogram, it's normal. The doctor will need to still do an ultrasound on you. So not all lumps are cancer, but you don't sit down and judge no lump.
Because some people have what is called fibrocystic disease.
Yeah, but fibrocystic breast is not cancer. That
Right.
lump,
No, that's what I'm saying. So it can be, you can have a lumpy breast.
yes, you can have a lumpy breast, and that lumpiness is not cancer. But don't sit down home and judge that lumpiness. Go to let the doctor examine you and see how you have to feel the lumpiness and see what it is, and then let the doctor send you to get an ultrasound if you're under 40, and if you're over 40, you will get a mammogram and an ultrasound.
So I suffer from fibrocystic disease. If I suffer, how do I know? I mean, before 30, before 40, if
So what
there
you
are
do,
any issues, how would I know? Because my breast am always lumpy.
I know, I understand what you're saying. So hear this now. From a woman, teenager coming up, start to feel your breast and feel the roadmap of your breast.
Okay, so you'll be able to note if there's any difference.
Get the roadmap. Get the roadmap. From your started teenager coming up, or if you never did it before, feel your breast. All the women listening to this podcast now, feel your breast. When you go to have your next bath, feel your breast and see how it feels.
How do you do that, Doc? How do you recommend?
You elevate the hand. So you'll use the left hand to examine the right breast and the right hand to examine the left breast. When you go in the bathroom, it's a nice place to go because the breast is smooth and nice. You go in the bathroom, you start feeling the breast in circles.
Soap it up, right? Soap it up. So
you start feeling. And you don't feel it by lumping it up like this. You feel it with the pulp of your fingers. Right? So you use the pulp of your fingers and you start to feel. Go in circles. Start from the edge of your breast and you make circles like if you consider your breast to be a clock.
Right.
Top is 12 o'clock, the bottom is 6 o'clock, and the outside is 9 and the inside is 3 o'clock. And you start from 12 o'clock and you feel going right around the breast. And you come around. And then you work your way in and make the circles, come in with the circle. So you make a circle from the end and you come in and come in and come in with the circle, feeling the breast until you reach the nipple and you feel the nipple. Right? And then you opposite now, and if you feel and you start at 12 o'clock and you feel the breast going right around on the outside, and you come in with the circle and you feel that breast, and if you feel anything rolling underneath your hand, underneath the pulp of your fingers, anything, check that out. If you're under 40, check that out, because the thing about it is that women who are not 40 years old as yet and don't have no cancer in the family is relying on feeling something to go and get it checked. Right? So the women who are under 40 have to be feeling the breast every month to see if they feel any lump or anything. And if they feel a lump, don't ignore it. Go and get it checked out. Now, when a woman reaches the age of 40, the tempo change. When you feel your breast, even if you don't feel a lump, you give thanks a lot. I don't feel no lump, but I reach 40. So even if I don't have no cancer in my family, I reach 40. So 40 change the tempo where even if your breast feel nice and iry, you take the iry breast them to the X-ray, the mammogram place, like Cancer Society, like Precision Imaging Center, like University Hospital, any X-ray place. Take the iry breast them to get them checked to make sure that the breast them iry for truth. Because the mammogram can pick up a lump in the breast 2 to 3 years before the lump reach size for you to feel it.
Okay. So you can see it from inside like almost a grain of sand.
Yes. So you want to know if any lump is in your breast, you want to catch it when it's like a gungo piece or a pinhead. You don't want to wait until that lump reach like a chinette or a guinea or a lime or orange or a grapefruit. Some people have some grapefruit side lump in their breast. You don't want no lump to reach that size because of a guinea or even a lime or orange. If a lump is in your breast, you want to catch it the size of a pinhead or a pin or a gungo piece. At that size, you can't feel it yet. But if you wait and don't feel it, don't go and do the mammogram to catch it, then it will reach lump and you feel lump. Now, not all cancers start by being a lump. Some cancers start by looking at little grains of salts, microcalcifications, grains of salt. Some cancers start like that. And I could tell you this, if you took some salt and you sprinkle them on your breast and feel the breast, you'll just feel a little grain in this, but you're not gonna feel no lump like a lime. You're not gonna feel no lump. So if it is that a cancer is in a woman's breast like little grains of salt, it's only the mammogram could pick that up. Your doctor can't pick that up. Your husband can't pick it up. Your hands can't pick it up because it is too small. It's only the mammogram. The advantage of the mammogram is that some cancers that start by looking at little grains of salt, only the mammogram could pick those up. The ultrasound can't pick those up. But you know, so those little grains of salt, don't want you to do a mammogram. You know, them vex that we have in this program, you know, Sister Sandra. Because them say, boy, calcifications in a woman's breast now saying, boy, I'm in the breast hiding, you know. I want to get chance to take root. I don't want this program. I don't want them women to go do no mammogram to catch me. I want to be like that thief, you know. Is that the little grains of salt are in some woman's breast right now. And vex that you see in this program because they don't want you to go and catch the thief. If you
do we only check our breast or we check underneath the armpit in these areas where you might have some lump in between the breast?
Because I have women who have picked up cancer by feeling a lump under their arm, because some cancers.
That was me.
Really?
I had my lump was not in my breast tissue, the fatty part. It was in my chest wall.
Wow.
In the clock position.
You see it?
So my lump was picked up by an ultrasound because my mammogram, because you know the fatty part of the breast is where it's in the mammogram.
Right.
So because I was doing my self-breast examination on a monthly basis, because I had taken out a lump 9 years prior, and that was not cancerous. And so the doctor advised me that I need to, you know, check on a regular basis. And so, you know, I normally check. So I knew that when at night I was sitting down there and just kind of rubbing my chest, and I felt a hump. It wasn't even a lump. It was a thickening. Felt like muscle. Because I was working out hard at the gym, and I said, but the truth is it wasn't balanced on the other side. So I called my girlfriend and I said to my girlfriend, you know, Andrea, you know, I feel this thing in my chest and it feels raised. And I don't think I felt it before.
Right.
So she said, you know, something, Sandra, go and make an appointment. And of course I dilly-dally. So she made the appointment for me. And when I went and doctor did the mammogram, said, don't say anything. He said, you know what? Put my hand, because I was convinced that something was there. So he said, put my hand on the area. And if I put his hand on the area, he felt it. And then he did a ultrasound. And then after the ultrasound, he followed up with a needle biopsy, which proved conclusively that it was breast cancer.
Yes.
So let me ask this question, Doc. Would you advocate for persons to follow up with an ultrasound to look at the other areas after mammogram? Or is it not?
Very, very good question. So look at me now. The mammogram is a very good test to pick up cancer, right? The mammogram can pick up cancer. Let me tell you the positives of a mammogram now. So a mammogram can pick up if a cancer is starting like a lump, like flour, lump, right? It can pick up the cancer small before you can actually, this lump reaches size to feel it. For example, let's put it like pregnancy. I'm coming to your answer. I'm giving you the answer. When a woman is pregnant, before she starts to get morning sickness and belly start show and all of that, you can pick up the cancer in the urine, do the urine test. Pick it up before it starts show. So a mammogram can pick up the cancer before it starts to show. But in the breast, there are some blind spots that the mammogram cannot pick up good. Like way up the top, under the arm, under the bottom of the breast, down by the fold, down below there. Those areas can sometimes be blind spots where the mammogram cannot see. And that is why we advise women to be aware of your breast. And don't bury your head in the
Because
sand.
you are responsible.
You are responsible because there's a 10% chance that the mammogram may miss that blind spot, that cancer in that blind spot. So if you do a mammogram and you feel something, so that's why we say to women, feel your breast every month. After
To pick up any changes.
if you pick up any change, even if your mammogram is normal, go back to the doctor and say, doctor, me feel a change here, so put your hand here, sir. Put the doctor hand, doctor,
Right.
sir. Feel here,
Right.
sir. And don't
But
make the doctor
you don't know everything. You don't know everything, so you have to help yourself.
Yes. That God, the Lord make you wise, and the Lord say you must be wise. Wise as a soul, wise and harmless. So you feel your chest. If you go and do your mammogram and your mammogram come out normal and you feel something even today, yesterday, or you feel it tomorrow, go back to the doctor and say, doctor, feel ya, so put the doctor hand on it. And so even if your mammogram is normal and you felt anything, you should that mammogram should be backed up with an ultrasound. Because there's no perfect test. The only perfect being that exists, the only perfect entity that exists is God. God don't need no mammogram to know what's happening with you. God could look and say, daughter.
So one of the real reasons, Doc, why I invited you on this program is because we're not seeing the numbers. We're not seeing the numbers. Every year for the month of October, internationally known as Breast Cancer Awareness Month, you see the sea of pink. But sometimes I don't think people know why they're wearing pink.
Yes.
They hear about breast cancer, they fear breast cancer, and so educated, uneducated, people with money, people without money, still, Doc, not going out to get tested because they say that, or they hear, because some of them never go yet, that that mammogram is painful bad. Help me with that, Doc.
So there are some myths that I want to bust. The first myth is that mammogram causes cancer from squeezing the breast. That is not true. Mammogram can't squeeze cancer into the breast. As a matter of fact, mammogram is not supposed to be a painful process,
But why would it be painful, Doc? Is it because my breast is tender?
Some women naturally have tender breasts. Some women you can't even brush past their breasts. But I would say to a woman that even if the breast feels tender, take a Panadol and go and do the mammogram. It's worth it. It's worth it. But the mammogram test itself should not really be a painful test for people who normally don't have pained up breasts. But some women's breasts, even if you just brush past them, their breasts will be tender. If it is that it is so, here it is. Schedule the mammogram to your advantage. Do your mammogram after the period because the breast can be more tender before the period. So schedule the mammogram to your advantage and go after the period when the breast is less tender. Right? Then the next thing now, the mammogram should not be too tender. So if your breast is tender, go to a place that your hair don't have plenty pain. Because there are some people, some technicians, some of the technical staff can be a little rough on the breast.
Right.
So we are advising the technical team to be gentle on the people's breast. Then the next thing now is that the mammogram, even if you go to the most gentle place on the mammogram, you find that your breast is very tender, take 2 Panadol and go and get your mammogram done. Then 3, take 2, because let me tell you something. The pain of a mammogram is much less than the pain of cancer.
Absolutely.
So I would say to women, go get your mammogram done. Your mammogram is your friend. The Lord knew that women would get cancer in the breast and breast cancer would be a big issue for women. So he gave us a machine that could help us to pick up the cancer early. Take advantage of the mammogram and go and get your mammogram done. Each woman listening to us, if you have not done your mammogram in the last year, you should go and get your mammogram done.
Doc, a lot of women on this platform, they never had a mammogram. They don't know what it is. What is a mammogram?
The mammogram is an X-ray. It's an X-ray of the breast, a low-dose X-ray that can pick up cancer early before the cancer tell you good morning, before you have a lump. You reach the age of 40. Women who don't come from cancer family, anybody listening to me who don't come from cancer family, once you've reached the age of 40, you need to go and get your mammogram done. While you're getting your mammogram done, still feel your breast every month. And if you feel any change in the breast, even with normal mammogram, go back to your doctor for the doctor to tell you to get an ultrasound. Because the mammogram can be backed up by an ultrasound, but the ultrasound does not replace the mammogram. If you have cancer in your family, you may need to start your mammogram at the age of 30. Go and get the doctor. Go to your doctor to get your checkup to see if you need to start your mammogram before 40. If your doctor said to wait until 40, then you wait until 40. And when you reach 40, you go start getting your mammogram done. So at the age of 40, every woman should be doing their mammogram, whether or not they come from cancer family. If you come from cancer family, then you would have started it earlier. If you don't come from cancer family, once you reach the age of 40, then everybody is in the same monkey pants because your age becomes the problem. And you start getting your mammogram.
We have some ladies online, and we want to just welcome them into the conversation. We have Doc online. So if you have any burning questions, anyone out there, we have Valerie and Nadine, Pink Passion, Marcel, Latouche online. Any of you ladies have any questions you need, here she is in the flesh. Ask any questions, any burning questions, any myths that you hear about that you want to just clear up right now, because here is the expert. We don't carry nobody with dibby on this platform. We carry the top of the line doctors on this platform, or whatever subject we are talking about. We ensure that it's experienced people. This is what you do every day, right, Doc?
Yes, we do this every day.
Every day.
I tell women,
Rest time on Saturdays and Sundays. Are you open Saturday too?
Open on Sundays. We close on Saturdays. I go to church and open on Sundays. We open on Sundays at Precision just to please you, just to get you at your convenience. So you come to us, and trust me, we have women come to us right here. We have women go on Instagram. Go on our Instagram page, Precision Instagram page, and you'll see the experience that the women have of doing their mammogram. Come and get your mammogram done. We want to encourage you. As a matter of fact, women may be listening to us from whichever part of the world. Whether you want to get your mammogram at university hospital, you want to get it at Cancer Society, you want to get it at Precision, you're out of town, you're out of the country, wherever you are, get your mammograms done. Do not be afraid of the mammogram. The mammogram is your friend. We're not going to plant cancer on your breast to find cancer there. If you do your mammogram, and the thief of cancer, as you get older, you get gray hair, arthritis, forgetfulness, sugar, pressure, cancer. Getting older is good. The opposite of getting older is to die young. But as you get older, we get exposed to gray hair, arthritis, forgetfulness, sugar, pressure, cancer, and the like. The thief of cancer. So when you reach 40, the breast get prone to cancer just because of age. For men, when the men reach 40, the prostate get prone to cancer because of age. And when man and woman reach the age of 50, the colon get prone to cancer because of age. And if you're black, or black people get prone to colon cancer at the age of 45. So you just have to check yourself. Check yourself. The thief of cancer of any kind don't go to everybody's house, but it's only thief know which house it's going. So everybody, when the woman reach 40, you just have to go and check yourself just in case thief is coming. If no thief is coming, you would not find no cancer in the breast, and you just continue living. And then next year now you go check your mammogram again, and the next year and the next year, because you're still getting older. I had a woman today who used to do her mammogram every year. And for the past 3 years, when she reached 60, she said, "Cho, for the past 20 years, I doing my mammogram and they don't find nothing. We're not doing no mammogram." Until she reached 63 and felt a lump and came to get it checked. And she came and we found the lump, and the lump was cancer. She said, "Doctor, sir, I've been doing my mammogram every year from I was 40. And because it always normal, I decided to now bother with it.
Break.
Because I'm going to take a break." And then we found the cancer, and the cancer was so aggressive because we found it now, and she already had lump under the arm. She said, "Well, it's just 3 years when I done a mammogram, 3 years when I done a mammogram, lump meet my arm already. How that happened?"
So,
which
so,
one
doc,
are doing
so
it?
doc, you have different stages of breast cancer,
Yes.
right? So you have what, 5 stages?
We have 4 stages. The
4.
earliest stage of breast cancer 0, is the ductal carcinoma inside to when the cancer.
You call it 1 stage in a doc.
Huh?
We call it 0, so we call it 5. Because we say 0 is a stage.
You have, yes, you have
And that's
one.
because that's where if you catch it any at all, that's where you want to catch it,
You
right?
want to catch it
0.
at stage. You want to catch it early, at the stage when it is still inside too.
What does that mean?
That means that the cancer is in the site of the origin, inside tumor in the site of origin. You want to catch it early. So the earliest stage is if the cancer starts in the ducts that bring the milk to the nipple, right?
Okay.
If you catch a cancer while it is still in the duct that its origin, it's inside too. So the breast is basically made up of like 20 bunches of grapes. Each grape in the bunch makes the milk, sends the milk down the little stem to the main stem that brings the milk to the nipple for the baby to feed, right? If a cancer starts in the grape, that's a lobule, it's called a lobular cancer. If a cancer starts in the duct that brings the milk to the nipple, it's called a ductal cancer. If the cancer is still within the duct or the grape that it started in when you catch it, it's inside too. It has no ability to spread because it is still within the duct that it started in. That's the best time to catch it, when it is still in the pipe, the pipe that brings the milk to the nipple. If it's still in there when you catch it, it's inside too. And the mammogram could pick it up at that inside too stage.
So like me, doc, I was at stage 2 because when I did a nodal clearance, they took out 14 nodes from underneath my arm and 4 were positive. And so I had to do chemotherapy and radiotherapy, right? So we don't want to get to that stage because when it's a lower stage, it's less treatment, right?
It's less treatment. It's cheaper. It's less treatment, and the chances of a cure. No, the treatment for breast cancer. Let me just tell them now. The treatment for breast cancer, there has been so much advancement in the treatment for breast cancer, right? That breast cancer should no longer be a death sentence, right? But what you want to do is to give yourself the best fighting chance. The earlier we catch the cancer, is the better the chance that we could cure it. Right? So you want to catch it while it's inside too. We could still catch it at invasive, like you would have been, because you had nodes involved, but we still be able to chance to treat you to give you that longevity of chance. And then two, I want people to know that no 2 breast cancers are alike. Long ago, we used to think that we used to treat all breast cancer the same, right? But with chemotherapy, and we say, chemotherapy is where you give them, you kill all the fast-growing cells with chemotherapy, and because the cancer cells are fast-growing cells. Your hair, your nail, your eyelash, there are some cells that are fast-growing. So when we find somebody with cancer, long ago we used to just give them chemo and surgery. And the chemo now will kill all the fast-growing cells, and the ones that are not cancer will grow back. So your hair will grow back, your nails will grow back, and all of that. But nowadays, we found that there are some people whose cancer is caused by certain receptors or proteins. So long ago, so now we found out that in some people, estrogen, which is supposed to be a friend, caused the cancer. And there's HER2 that's supposed to be a friend that is overexpressed and cause cancer. So now when we diagnose cancer in somebody, we then do something called a receptor testing, where we check to see if they have any traitor cells on their body that cause cancer to come into their body. So your estrogen, that is supposed to be the friend of a woman. Estrogen is the thing that make you get nice bottom and breasts and curves, and girls are made from sugar and spice and all that's nice. Estrogen is what makes girls a girl. But in some women, estrogen that is supposed to be a friend turn around and let in cancer. You ever have a security guard that's supposed to be guarding your house? The security guard let in cancer. What you do with that security guard? You would fire him. So what we do now, when we find cancer in a woman, we then go on to do another testing on the tissues to see if estrogen is causing cancer in them, to see if the cancer is estrogen positive, or to see if it is HER2 positive. And if we find out that estrogen is the traitor that is causing cancer in that woman, we will give them, not only we will give them something to block the estrogen, like
Yes.
tamoxifen or
Right.
anastrozole.
I was on tamoxifen. Well, I should have been on it for 5 years. I was a bad girl.
Yes.
I came off after 2 because it was
Right.
giving me serious bone pains.
Right.
But you know,
Right.
it operates differently for different people.
That is it. No two people are like, not everybody
Yeah.
will get away like you. So
Yes.
some people cannot, so you cannot look at Sandra and say your cancer is like Sandra cancer. So some people have estrogen positive, HER2 positive, triple negative. We have a number of different types of cancer.
Yes.
Some are more aggressive.
I was
So-
going to ask you about the triple negative because I hear that's really a tough one to treat.
But we can still treat it, but it's still
Yes.
a bit tough to treat. But we customize the treatment for cancer based on the type that a woman has. So don't compare yourself. Now watch nobody.
Right.
Your cancer is your cancer. Let us get you treated, get you sorted out, and put you on the package that suits you. Each woman get a different package of treatment for their cancer.
Right.
And so we customize the treatment to give you your best possible chance to fight that cancer.
Yes.
So we don't
Valerie's sorry, Doc. Valerie's asking if you can just walk in and get checked, and what's the cost?
So yes, once you've reached the age of 40, you do not need a paper from a doctor to get your mammogram. Just like you can get your pap smear, you can get your mammogram done, right? And now we have NHF gives a $3,000 subsidy on mammogram if you have an NHF card. All women who have reached the age of 40, you can go to your doctor to get an NHF card so you can get a discount on your mammogram. Right? That discount is offered at different places, like Cancer Society gives you that $3,000 discount. Precision Imaging gives you that $3,000 discount. University Hospital gives you that $3,000 discount. Another X-ray place, I think Apex gives you that $3,000 discount. So there are different radiology centers that have applied to NHF to get that subsidy, and you go and you swipe your NHF card, you get $3,000 discount on the mammogram, and you get your mammogram done. Right?
Wonderful.
So that's a plus.
And also, if you have the NHF card too, I mean, a lot of the drugs are on the NHF cards.
Yes.
Reduce the cost.
Yes, of the mammogram.
Yes.
Right?
Mm-hmm.
So you don't need, once you reach the age of 35, 40, you don't need a paper from a doctor. We say once you reach the age of 40, you could join the mammogram party. You don't need no ticket. Just pay at the gate and come in and get your mammogram. Right? You don't need no paper from a doctor. You don't need no request. Just pay at the gate, come in, get your mammogram done. Right? And you do that, and you just keep doing that every year. There is no age to stop. Every year you come get your mammogram done. Don't let off. Don't give the devil no chance with your body. Come and check yourself every year.
One question that we don't really talk about, or one thing we don't really talk about either. Does breast cancer come with pain?
Well, breast cancer not stupid, The breast cancer tends not to give you pain early, because if it gives you pain early, you will catch it. So most times in the early stage of a cancer, you don't have pain. But there are some women who you can't really say that breast cancer won't give pain, because there are some women who breast naturally feel pained up. I had a patient who was 28 who I caught cancer on, who said while she was pregnant, she had a heaviness in one breast. And the breast was heavy, and they said that it's because of the milk in the breast why the breast was heavy. So she went and she did an ultrasound, and the ultrasound was normal. So the doctor said, well, your ultrasound is normal, so you are fine. She went on, that one breast was still heavy. She had the baby, breastfeeding, and the same breast was still heavy. Doctor sent her to have another ultrasound, and the ultrasound was normal. So he said, Mom, it's just because of the breastfeeding and the milk in the breast why the breast is heavy. So she said, okay, when the child reached 4 months, she stopped breastfeeding. But she found that one breast was still heavy. So she said, hey, doc, the breast is still heavy. So the doctor said to her, your mammogram, your ultrasound was normal. She's just 28. Your ultrasound was normal, and there's nothing to do, because But then he took up the phone and he called me and said, Derria, doc, I need the patient to come to you because she sent her to get 2 ultrasounds. The ultrasounds were normal, but she stopped breastfeeding now and the breast still heavy. So she came to me and I did an ultrasound, and of course they could see where the Cooper's ligament were disrupted. And she didn't really have a lump in her, but she had disruption in the Cooper's ligament. So you could see that the cancer was there like a snake in the breast, flat, no lump.
Wow.
I say this, and so we did a biopsy and she did have cancer. So what I'm saying is that any change in how your breast feels,
Yes.
or any change in how your breast is behaving, don't ignore it. Get it checked. If you're not 40 yet and you have a change in the way the breast feels, get it checked. Don't say because you're young, you're not going to check it. Get it checked. If you reach 40, you do your mammogram, because by 40 now, everybody should be doing their mammogram. If you do your mammogram and it's normal, but your breast start to feel different, go back and tell your doctor and make them do add an ultrasound to the package. Another thing we didn't touch is dense breast. If you have a lot of glands in your breast if you have a lot of glands that make milk in your breast, we will tell you that your breast is dense. If you have plenty glands that make milk, those glands look white like milk on the mammogram. And that whiteness can hide cancer because some of the cancers also look white like milk on the mammogram. So when you have dense breasts, it means that you have a lot of glands that make milk. Having a lot of glands that make milk can increase your risk for getting breast cancer. And then now the glands that make milk can end up hiding the cancer on the mammogram. So women who have dense breasts, we back up the mammogram with an ultrasound. So you know, some women come and say, Miss Doc, so if it is that they say that my breast is dense, meaning that I have a lot of glands that make milk, and I have to be doing an ultrasound whenever I do the mammogram, why not leave out the mammogram and just do an ultrasound?
No, right.
We can't do that. We have to still do the mammogram because it's not all the cancers that look white like milk. Some cancers look like little grains of salt and that have a different shade of white to the glands. And the mammogram is the only thing that show up those little grains of salt. And
Okay.
so if we did not do the mammogram and just do the ultrasound alone, the cancers that look like little grains of salt, we would miss those because the ultrasound can't pick those up. So for the woman with dense breasts, you still have to do your mammogram to see if you have the grains of salt in your breast that could only be seen on the mammogram. And we have to do your ultrasound to see if you have any of the ones that can be hidden by the mammogram, by the glands. So, you know, we have to, this is the work that we are doing. It's a detective work, you know. It's police.
I know.
Catch thief.
Yes. And that's why you have to be involved.
Right. Because some teeth could, in the people who have dense breasts, some teeth, which is the cancer, could hide from the mammogram, but they can't hide from the ultrasound. While some could hide from the ultrasound, but they can't hide from the mammogram. So it's a detective work where we're using different teeth, different police, different types of detective to catch the
You touched on it a little bit, Doc. But I have seen a few, or I have counseled a few women who discovered a lump during pregnancy. Can you talk a little bit about that for me?
So pregnancy, first of all, women who are pregnant, once you've reached the age to screen. So women who are, if you have a woman who supposed to have been doing your mammogram from 30 because you have breast cancer in your family, if you get pregnant during that time or in your 30s coming up, if you have an increased risk for breast cancer, you should still be able to do your mammogram. Pregnancy is not a deterrent to doing your mammogram. Women who are pregnant, if you are over 40 and pregnant, you should still be getting your mammogram because the dose of radiation from the mammogram is very low dose and it would not affect the pregnancy. 2, if you are breastfeeding, you should still be able to do your mammogram once you are of the age to do your mammogram, because breastfeeding, all we do, we pump the milk out before the mammogram and then do the mammogram. So you should still be able to do your mammogram if you're pregnant and breastfeeding once you are of the age to do your mammogram. If you feel a lump during your pregnancy, do not assume that it is milk, the milk glands that clog up. We have a number of women who get fooled by that. Anytime you feel a lump, pregnant on, even if in pregnancy, get that lump checked out. Don't sit and assume that it's clog up milk in the breast. Check it out. Let your doctor send you for a mammogram. Another thing is that some women go to their doctor examine them,
Yes.
find that no lump is in the breast and say, oh, you're good, you're over 40, but I don't feel nothing, so you don't need to do a mammogram. The doctor's hand cannot pick up early breast cancer.
Yes.
If you feel a lump at any age, don't ignore it. If you feel a lump in your pregnancy, you feel a lump outside of pregnancy, you feel a lump, any woman that feel a lump and any man that feel a lump, do not ignore any changes in your breast. People, crowd of people, don't exclude, don't ignore any lump in your breast. Anytime you feel a lump, whether you're 40, under 40, over 40, male or female, any gender, no gender, whatever gender, if you feel anything in your breast, go and get it checked.
Another thing that I am aging, I have breast cancer in my family, and this is not something that I'm guessing. This is what happened to a friend of mine. She was aging. She wanted children. She had her sisters, 2 of her sisters had breast cancer. However, she wanted children. She couldn't have any children. So she went and she got the injection.
Yes.
Is that something recommended when you have, because even after that, I don't know if it's connected. I'm just telling you what I saw. After she had the children, she had twins, and shortly after that, she was diagnosed with breast cancer. It was actually late-stage breast cancer, or should I say aggressive, because she did a mastectomy. They didn't know that clearance. This is in the States. They found 32 nodes positive, and they still did reconstruction. That's another thing as well. I guess I don't know if that's in your area or that's in that area for the surgeon. But I was confused as to why they would have done reconstruction if it was so late. And I was wondering if because she was predisposed to it, if taking the drugs to become pregnant increased her risk.
Well, first of all, when you go to your gynecologist for fertility issues, one of the first things they will do is your history. They will do your risk assessment based on your history. And then based on your history, we don't know what her background, all of the factors of her history would have been, right? So once they do your risk assessment, they would know whether you should go on these fertility drugs or not. Now, I am not saying that any of these fertility drugs increase the risk of getting pregnant.
Would you recommend it though?
Of getting
Would you recommend it?
I'm not saying
I have breast cancer in my family. Is that something that would have been recommended?
I would not say no, because we have women who have been pregnant, get breast cancer, make their children, get treatment, and go back and get pregnant and are fine. So it is not a question that I could answer straight up, because my
thinking is that if breast cancer is driven by estrogen, and a lot of these shots, are they estrogen shots? Are
not necessarily. Okay. Not necessarily.
Okay.
Because pregnancy actually,
that's why I'm asking.
Yeah, because pregnancy can actually help women who get pregnant and breastfeed. That actually helps to decrease your risk of getting breast cancer, because your body is the hormone changes during pregnancy and breastfeeding decreases the amount of estrogen circulating in your system during that time.
But I was told not to get pregnant.
We know women.
I was 35.
We have women right now who get pregnant, can put their eggs up and get them. If you go, no. I know, I've seen Dr. Robert Patrick have patients who are pregnant, they get their treatment, get their baby, live their normal life. We have known women who get the eggs stored
Yes,
while getting cancer treatment, and then
I know
after
a
that
few.
they go back and get their children. So there's been a lot of advancement in the management of breast cancer now. There's a lot of advancement, and it
Our
goes
our youngest our youngest member, well, she wasn't a member at the time, but she had breast cancer at 16,
yes,
and she later went on to have two kids,
yes,
and I'm not sure if she's in her late 30s or early 40s now. So
right,
I know it can happen, but in 99, I wasn't really told to, that I could, save my eggs and,
right,
try at a particular time. That
right.
was not really sold to me.
No, because that was not known then at that time. In the
Okay.
90s, you see, there's so much advancement in the knowledge and research for breast cancer now. There's a lot of advancement in the technology. A lot, and so and that is just natural progression of improvement as we go along. So breast cancer is no longer a death sentence. We have patients who get their babies and then get pregnant, and then they have their treatment and save the eggs and stuff. But this is not something that would have been so common in the 90s.
Mhm.
You understand? So there's a lot we know now. No two breast cancers alike. We actually customize the
Well,
we
the treatment.
customize the package of treatment for each woman depending on the type of breast cancer that she has. You understand?
Eugene is asking, what if you do an annual mammogram every year, but after a while, the mammogram results start showing dense breast?
Well, we don't know. The fact is that maybe the breast might have always been dense. But if at any point the breast starts to look dense, that needs to be backed up by an ultrasound, and we need to make sure. Now, for women who have dense breasts, dense breast increase the risk of breast cancer, and then it turn around and hide the cancer for some of the cancers, because the white dense tissue, the glands, can turn around and hide some of the cancers that look just the same color white like the glands. In women with dense breasts, we do mammogram, we do ultrasound, but we can also add MRI to the package to
I was just about
decipher.
to ask you, are there any other tests?
Yes,
So there's a breast MRI now, correct?
yes, we could do MRI on the breast. So women who have the genes for breast cancer, who should actually start their mammogram at 30, we could do mammogram and MRI on these women. If they
Is
can't,
the MRI an option for mammogram or not?
yeah. So the MRI is not a substitute, but it's an so okay. There is nothing that replaces the mammogram.
Okay.
The mammogram is needed for women who, if you have family history of breast cancer and you have increased risk of breast cancer, you start your mammogram at age 30. If you do have no cancer in your family, you start your mammogram at age 40. If you have cancer in your family and you have the breast cancer genes for breast cancer, you start your mammogram at 30 and you back it up with an MRI, right? If you have dense breasts, you do your mammogram and your ultrasound, and you can add MRI to the package, but because MRI is costly, we don't put
Yes.
a rule that say women with dense breasts must have mammogram, ultrasound, and MRI, and mammogram and MRI, because people going to say, them just call MRI because they want the people them with the mammogram machine, the MRI machine to make money.
Right.
So we don't want it to look like we're trying to make money, but MRI does increase the pickup for cancer in women with dense breasts. Let me explain it to you. If we have 1,000 women with dense breasts and we did mammogram and we pick up X amount of cancers, if we added ultrasound to that, we'd pick up an extra 7 cancers out of that 1,000 women. And if we added MRI, we pick up an extra 16 cancers. So MRI does pick up more cancers in women with dense breast, and it does increase the pickup rate for cancers that could have been hiding on the mammogram and the ultrasound. So MRI is a big deal in increasing the pickup rate for breast cancers in women with dense breasts.
All right. So one of the main things I would say that's causing prevention is fear. What is your advice in terms of, tackling that fear? And I mean, nobody wants to get a diagnosis of breast cancer. I mean, it was absolutely shocking. I was not expecting it at 35. It's not something that was even on my radar. So, I mean, how do you say to the women on the platform and the men who, how do I navigate this? Any advice, Doc?
God has not given you a spirit of fear, but of power and of love and of a sound mind. If you have to take on fear, you might not even come out of your bed.
That
You
is
get up and
true.
you don't even come out of your house.
That is true.
Right? If you have to live out of a spirit of fear, you live out of a spirit of faith. And you move forward in faith, because faith without works is dead.
Absolutely.
So I want you to have a faith position that only the Lord knows what is in my future. Only the Lord knows what could happen to me.
Right.
So what I want to know is that the Lord said you must be wise. So when you've reached the age of for screening, if you don't have any cancer in your family, once you reach 40, you know that that's the age that the risk of cancer increases. So you start doing your mammogram. Peradventure, most likely nothing is there to be found. But if something is there, then you catch it early. If you catch it early, you don't need to fear.
And as we said before,
And you
so
treat
not
it and you move
all
on with
lumps
your
are
life.
cancerous.
And not all lumps are cancerous. So don't live out of a spirit of fear. Live out of a spirit of knowledge of knowing what's happening in your body. If cancer is in your body, you need to know. You don't want to wait, because the ladies who are fearful, people who are fearful, some people even have lump. They fear, and wait until the cancer get away. Then you
Right.
fear that.
And it's harder to
And
treat
it's
when
harder
it's
to
spread.
treat. So better if something is there, catch it early, deal with it, head on, deal with it, put it away, and move on with your life. Fear is not
Yes.
from the Lord. Fear is not of
Yes.
God. Fear is not of
Absolutely.
God, because the fear is a cripplement. Fear is actually a bad strategy. Let me tell you why. If you fear something, you are giving it a chance to take you over
You're
and
giving
give
it
it the
energy.
words.
Give it energy.
You're giving it energy.
Yes.
Don't give it energy. In other words, if you have fearing something to the point where you don't get yourself checked, doesn't mean that it is going away.
Right.
You're giving
Absolutely.
it energy to overcome you. So you need to now take up yourself and roll with God every day. Get up every morning, do your devotion, energize yourself with God, and then you take on the day and say, God, you know exactly what is in my day. I am rolling in faith, and I'm going to get myself checked. If anything is there, I don't want nothing. But if anything is there, let us catch it early and deal with it, and let me move on with my life. Fear is crippling.
If you have had other types of cancers, are you at higher risk of getting say breast cancer?
Well, a history of ovarian cancer. Ovarian cancer increases, if you have ovarian cancer in your family, that increases the risk of breast cancer. Pancreatic cancer, if you have a family history of even prostate cancer, if you have cancer history in your family, go to your doctor and discuss that,
Okay.
so that whatever risk prevention methods can be implemented, they will be implemented, right? But the truth about it is that regardless of your history, if you have cancer if you reach 30, go to your doctor and get a risk assessment. The most things that we do to if you have the breast cancer genes in your family, you have chemo preventive methods that can help you to decrease your risk for breast cancer. Whether it be doing your mammogram from early, taking tamoxifen medication from early to decrease your risk of breast cancer if you have the genes, even having a double mastectomy like Angelina Jolie as
Right.
a risk reduction method. Whatever it is, we know. Don't be your own doctor. Don't sit down home and doctor yourself.
Right.
Go to your doctor and get yourself checked. Go to your doctor and talk to your doctor about your risks of breast cancer. When you reach 30. The most the doctor will say to you is, hey, you need to start your mammogram from now, or you wait until 35, 40. When you reach that age of 35, 40, if you don't have not risk of cancer in your family, start doing it. Keep your life simple. Start doing your mammogram, and you do your mammogram every year until you die of old age. And if it is that we find anything in your breast, we will get you sorted out.
Right.
Do not take your life into your own hands.
And we are equipped in Jamaica, aren't we, Doc?
Yes, we are. We have the best doctors here. We have the technology here. We have the best treatments, oncologists, surgeons.
Although the expense, Doc, the expense.
Get your insurance. Get your critical illness insurance. All women and men, get your critical illness insurance. So that should, in case something is found, you can get the treatment and pay for it. Get your critical illness insurance and go on and live your life.
Well, this was a earful. So, Doc, as we wrap, just we want to just remind our viewers.
I just want women to do.
Just want to remind them, some of the signs of breast cancer as we wrap, and what they need to be doing, going out and getting their mammograms at what age. If you have it in your family, you start earlier than 40. You also need to know your family history. Have a conversation with your doctor. Tell him your family history. High risk groups, you want to ensure that you keep your weight low, right? You ensure that you have a healthy lifestyle. You don't want to live a sedentary lifestyle. You want to remain active. Keep your weight down. Mm-hmm. Yes? Mm-hmm. If you have siblings, grandma, mom, anyone in the family that has any type of cancer, not just breast cancer, you said ovarian cancer puts you at high risk.
Yes, ovarian cancer puts you at high risk. For
uterine as well, Doc?
Sorry?
Uterine as well?
Not uterine.
Just
ovarian cancer increases the risk of breast cancer. Right? All right. So go to your doctor when you reach the age of 30. If you're in your 30s, go to your doctor and have a chat about your risk assessment to see if you need to start your mammogram before 40. Right. If you need to start your mammogram before 40, start it. Simple. You do your self-breast examination every same time after your period, right? Not during your period, after your period. Because during your period, the breast every month to be able to identify any changes. Yes. If you see any changes, you said that once you reach what age you don't need a referral? Once you reach the age of 40, okay. You don't need a referral. You do not need a referral. If you see your nipples inverted, if you see your one breast is the nipples are turned, they're supposed to pointing sideways or inverted. Right. Check that out. Pimpling of the skin. Mm-hmm. Rash. Mm-hmm. Mm-hmm. Right? Rash on the nipple. On the nipple. Lump underneath the arm. Check for lumps underneath the arm. In the neck area. Yes. In between the breast. Yes. In the chest area. Mm-hmm. So you're gonna feel up yourself. It's your body. Yes. Make sure you check for anything unusual, anything that's new. You wanna check. Patricia says, what if you are afflicted already and don't have critical care insurance? Well, I mean, that's the public sector, KPH. If you already have breast cancer and don't have critical illness, I don't think you could get critical illness after that. No. Right? But just go and keep your checkup with your doctor. Keep your checkup. Keep on top of yourself. Because you have to... No, but you should have to do what you have to do at a public hospital. Should have to go to the KPH. Go to the public hospital. Get your checks done. Continue to get your checkups. Get your checkups done. You have to make best of the situation that you have at hand. Right? Yes. And Patricia, we at Jamaica Reach to Recovery, we do have assistance
You can call our offices at 876-978-0375. You speak with Ingrid, and she will direct your path as to what kind of assistance you are able to get. Do not just throw your hands up in the air and give up. Jamaicans does not have a give up spirit.
Yes.
You want to push forward same way, not because it seems mountainous, you are going to give up. There is always the public system. Yes, the line is a little long. Yes, but you still have to try.
Yes.
So for those who are not yet there, and remember now, with insurance, the younger you are, the cheaper it is to acquire.
So
the older you are, the premiums are more expensive. And once you have had cancer, you won't be able to get those policies again. I can tell you that. Right? You don't get it. Well, it certainly doesn't cover. You can get it, but like I have ProCare, but it doesn't cover cancer. Things like that. Right? So you want to be proactive. So Doc, where do we find you?
I am at Precision Imaging Center, 15 Caledonia Avenue, Crossroads.
Okay.
And we can navigate you through your journey. I'm at University Hospital as well. We can navigate you through your journey as we get you on the right pathway to maintaining health. And the Lord said, the Bible, I just want to tell you about 3 John 2, where the Lord said, Beloved, I wish above all things that thou mayest prosper and be in good health, even as thy soul prospered. You know why the Lord said, I wish that thou mayest prosper and be in good health? Because the Lord could do so much and no more. He has to wish that we are in good health, because part of us being in good health includes us doing a healthy lifestyle and getting our checks. So if you don't go and get your checks and your mammogram and stuff, the Lord can't force you, go force you to your house to go get your mammogram. He could say, Lord, help yourself. You have to help yourself. Right? Because the Lord can wish us to be in good health as much as He wants. We have to get up and walk with Him and say faith and works, and go with the Lord and come get your mammogram done.
Yes.
Because if you don't get your mammogram done, the Lord could wish you be healthy and prosper. But if you don't do your part, it's only a wish.
You have to do your part.
You have to do your part so you could fulfill
and formulate. I always like to say formulate body systems. Where you're an accountability partner for your friend.
Yes.
Normally you and your best friend is normally the same age.
Yes.
So our ballpark, same age. They want to be an accountability partner for your friend. There's always Jamaica Reach to Recovery as well. If you're already diagnosed or if you're going through breast cancer, excuse me, and you want a sisterhood, we meet every second Tuesday at Webster's Memorial at 5 p.m. We are over 150. Not everybody comes to meeting every week, but I mean every week we have about 50 people or more. We not all the time we discuss breast cancer. Sometimes we just have fun, but we discuss, we share stories, we welcome new people, we give them advice. We tell them about our journey, that you are not alone, because as you know, it's 1 in 8, right, Doc, in Jamaica, yes. the global country.
About 1 in 15.
1 in 15. Well, 1 in
Jamaica, but globally it's 1 in 8. Yes.
Yes, 1 in 8, and not only that. Remember now, a lot of people are not getting tested, so we don't even know the true number. So that's why we said to you, you need to go out and get tested. Because we don't even know how vast the situation is, because the persons who are getting tested, the numbers are extremely low. Too many
20%
people.
Of women. 20% of women in Jamaica are going to get mammogram.
20% of women
are going to get mammogram when they don't have any lumps. Yes.
If you get 20% in an exam, you get an F.
Yes. Yes.
Right? So 20% of women going out to get tested, that is way, way too low.
Yes,
have to do with the women.
Yes. 20% of women are going to get their mammogram.
Not let fear cripple you.
Yes.
So, anything else you wanted to say, Doc, before we wrap up?
All women who are listening to us, if you have already reached the age of 40, you should all be doing your mammogram. Even if it's one breast you have, don't matter the size of the breast. Even if you have teacup, trainee size cup, big breast, little breast, any size breast. If you think about it, if you have not had your mammogram for the last year, you need to take your breast stem on an outing and let the breast stem get your mammogram. Take the breast on an outing and take them and get a mammogram to make sure that your breast stem nice for truth, and take your breast back home. Every woman with breasts, 1 or 2, no matter the size, give your breast an outing. Take them to the mammogram place, get a mammogram.
How do men get tested, Doc? We didn't touch on that. What? Before we wrap up, we don't want to say that. We don't want us to say that we'll leave them out as usual.
Who is that?
How do men get tested? Because they don't do mammograms.
Their breasts. Men need to feel their breasts every so often, every month or so. Just check yourself, examine yourself. And at any point in your life, if you feel any lump or anything, go to your doctor, and your doctor will send you to get your ultrasound or your mammogram or whatever done. There's not a screening protocol for men to say, oh, when you reach 40, you need to come get your mammogram or so. Men just have to feel themselves, feel their chest, and if they feel any change, go and get it done. Now, the men who comes from the breast cancer family, like the BRCA1 and the BRCA2, they could discuss that with their doctor.
So they could have the gene too?
Men, yes, if it's a gene is in the family, it's in your blood.
Really?
Right? Yes. And if they are in a family with the BRCA gene, they could discuss with their doctor, because they may send them to have a mammogram done when they've reached the age of 45 or so, 40 or so. But it's not a hard and fast rule. Main thing with men is that they must feel themselves, check the chest out, and anytime they feel anything different, get that checked. No matter the age, get that checked.
Thank you. We did an hour and a half. Only lump can be found. Only lump can found in male?
No, men can get nipple discharge, men can get rash, men can get redness on the breast, men can get swelling. Any change at all you don't want to, don't take no change. Only take dollars, no change.
Well, this month is October Breast Cancer Awareness Month, and October 26th, because we are from Jamaica Reach to Recovery, we can't leave without a shameless plug for our pink run coming up on October 26th. We kick off at 6 o'clock with warm up at Emancipation Park, and the race starts sharply at 6:30, and it's a 5K run, walk, or wheel. It's our major fundraiser this year. Well, every year it's our major fundraiser for the last 25 years, except for when COVID was around, right? So, we want to encourage persons to come out and support us. If you want to walk to honor your friend, walk with your friend, walk because your friend passed, it is a nice family vibe, and we encourage persons to come out. Our secretariat, where you can get your merchandise, is at Summit, and that is at 16 Chelsea Avenue, or there's also an entrance on Ruthven. We are at room 1149, that's upstairs at the Summit, and you should register for the run on pinkrunjm.com. When you go on the website, you see all about us. And if you're in a group, you can call our offices, and we will send you an email with the upload form that you can register your team with all the information, and we send it back to you with an invoice, and your team is fully registered. So we want to say thank you for joining us. Next week, same time, because it's 5 Thursdays this month. We did one last week. You can go and check our pages. This week, I had to start with Dr. Cornwall, because I wanted you ladies to hear, and men, to hear about and all the myths of mammograms, and that a mammogram is essential to your survival, to finding breast cancer early, because early detection is the key to survival. The earlier the better, the earlier the cheaper, right? And we don't want to lose one person, right, Doc?
Amen.
Not even one we want to lose. So, and if you catch it early, the survival rate is extremely high. Am I correct?
The 5-year survival is very high. Yes.
Absolutely. So you don't have to be fearful.
No.
All lumps are not cancerous. So if you find a lump, do not panic. So thank you so much, all the persons on our platform. Thank you very much for joining. We are so happy that you were with us this evening. Look out, same time, 7:30 on Thursday next week. We have another expert on our platform giving you very important information about breast cancer. Because we're only dealing with breast cancer. We're talking up the things them about breast cancer. October alone is not, breast cancer is not only in October alone, but at least we got an entire month to talk about it, for you to also ask questions about it.
Yes.
But you choose your time, pick your time when you want to go out and get your mammogram done. But in lieu of your mammograms, do your self-breast examination after your period. So I'm repeating myself, after your period, the same time every month, so that if you find if there's a new lump, a new bump, a new hump, you will pick it up early, right? And as you find a lump, please do not delay. Cancer is time sensitive.
Yes.
Time sensitive. The earlier, the better. Please, I am begging. So, see you next week. Same time.
Ciao.
Thanks again, Doc.
You're welcome.
You want to give a number? You want to give your number so that they can call the offices?
Yes, they could WhatsApp 876-880-1973. 876-880-1973. You could WhatsApp and ask any questions and ask them to ask Dr. Cornwall and they'll get in touch with me. 880-880-1973.
And where are your locations again?
15 Caledonia Avenue, Crossroads. That's Precision Imaging Center. 15 Caledonia Avenue, Crossroads.
And they say you're also at?
University Hospital of the West Indies. Women's Imaging Center.
Lovely. Thank you. Good night, everyone. See you next week.
Ciao.
Ciao.
The Pink Run is more than a 5K run or walk. It's a chance to honor survivors, support fighters, and remember those we've lost.
Whether you've lived it or loved someone who has, this is your moment.
Join us on Sunday, October 26th, and let's walk, run, and restore hope together. To register, call 876-445-9407. Pink Run is brought to you by Jamaica Reach to Recovery.
Pink Run is powered by Catherine's Peak, Juicy Patties, Jamaica Moves, JP Foods, Supreme Ventures, NHF, and M Catering. Reaching hearts, restoring hope.
The Pink Run is more than a 5K run or walk. It's a chance to honor survivors, support fighters, and remember those we've lost.
Whether you've lived it or loved someone who has, this is your moment.
Join us on Sunday, October 26th, and let's walk, run, and restore hope together. To register, call 876-445-9407. Pink Run is brought to you by Jamaica Reach to Recovery.
Pink Run is powered by Catherine's Peak, Juicy Patties, Jamaica Moves, JP Foods, Supreme Ventures, NHF, and M Catering. Reaching hearts, restoring hope.